So cataract is a yellowing of the lens, and this causes a generalized visual decline and a fog. Macular degeneration is damage to the central part of the retina. This is the area used for reading. So the retina is described like the camera film. So even though patients may have end-stage macular degeneration, they can benefit symptomatically from cataract surgery, as they may not be able to read a newspaper, but they'll get overall brightness. The glare will go away and they'll be able to see things from the corners and get more light going into the eye. So over the years, I have seen patients who've been told nothing can be done, yet after cataract surgery, patients have been really happy with the level of vision they've had. Ideally, if someone has both conditions, I like to ensure that the patient has had a few injections of anti-VEGF agent, so Lucentis or Eylea, to stabilize the macular degeneration before undergoing cataract surgery. It is also possible to give an injection at the time of cataract surgery. Why would I do this? Because any type of surgery causes increase in inflammation and certain little factors that can cause reactivation of macular degeneration. So we know that at the end of the cataract operation, I can give an injection that can reduce the risk of this happening. If someone comes in with both, then I would always give them the first 3 injections once a month, then review them. And when I think they're on a stable basis and having maybe injections 6 to 8 weekly, I time the cataract and then see them very soon after to look for any activation of the macular degeneration. There is no reason to say you can't operate on the cataracts if someone has macular degeneration. It's just about timing it right and managing expectations. It's explaining to the patient that they may not get the visual benefit they expect, and if one eye's got the macular degeneration and the other may not, then both eyes may not be the same after the surgery. In the past, people who had macular degeneration in one eye, it was advised that they should avoid the other eye until absolute necessary. But we know that leaving cataracts for too long has its own problems, because leaving a cataract to grow too thick can cause secondary inflammation and raised pressure, causing glaucoma, secondary glaucoma. Now the equipment has improved, the surgery technique is very efficient, and I think anyone who is struggling from a cataract can benefit from cataract surgery despite having macular degeneration, because the surgery can give the patients that peripheral vision, which is reduced from a cataract. Nowadays, cataract surgery is very successful, where 95% see better after the surgery. When we consent the patient, so when we explain the procedure, we always say there is a 1 in 100 chance of needing more than one surgery. Sometimes we can't put the lens in on the same day. Sometimes we need to wait to do this. But still, they would see very well after the second procedure. And 1 in 1,000 have a risk of a serious bleed or infection into the eye. This is a risk of less than 0.1%. Recovery depends on the age of the patient, the type of surgery, and how thick the cataract was, and also other factors. For example, if they're diabetic, ethnicity also has implications for recovery, because we know that some ethnic groups can get more inflammation. Some patients can recover and see very well after day 1, but on average, 3 weeks is quoted for recovery from cataract surgery.